To the best of my knowledge, we have not had any cases of this in Bermuda. There's been about 150 or 160 in the United Kingdom and roughly the same number in the United States. You see cases of liver failure every year from a number of different causes, sometimes medications, sometimes what we call idiopathic, that is to say no identified cause. What we're seeing now is an increase in the number of idiopathic or unknown cause liver failures in both of those countries. The leading thought is that it probably is a viral infection, probably an adenovirus, which is a class of viruses that causes a different range of symptoms, usually runny nose and cough, sometimes gastrointestinal upset like vomiting and diarrhea, and apparently in the last year, a very small number of cases of liver failure.
Could there be a mutation that's causing these severe cases?
That seems to be the leading thought at the moment. Yeah, is that it's a strain of adenovirus that hadn't previously been seen. Yeah, so likely some sort of mutation. And I think it's worth emphasizing that these cases of liver failure in the United Kingdom, they're not linked to each other. So there hasn't been any two children in the same school or the same daycare that had it. So if this is caused by an adenovirus, it appears to be a very rare complication of a very common infection. We likely will see adenoviral infections throughout the spring and the summer, which is the time we often see them. But even if it does come to the island, the chance of us having a case of liver failure from it is quite low.
What should parents just be on alert for in the rare instance?
These cases tend to start with regular intestinal symptoms, so vomiting, diarrhea, abdominal pain, which we see all the time in kids, as you know. But the thing that puts up red flags and gets people's attention is the yellowing of the eyes, really darkness of the urine, and then light-colored stools. Those are all pretty striking features. You wouldn't miss them.
It just seems like there are a lot of viruses going around the island. I think, again, with taking masks off and people traveling.
It does feel like people are making up for lost time with all the illnesses they didn't get in the last 2 years. So we've seen, obviously, there's still a fair bit of COVID going around. At this point, fortunately, most people have a bit of immunity, either from vaccination or from a previous infection. So the COVID that we're seeing isn't as severe as it was last year, because people have some degree of immunity. A few cases of hand, foot, and mouth disease, which is a classic childhood illness that most kids get. There's been a bad stomach bug going around at the moment, lots of vomiting and diarrhea. And we've had a number of initially kids and then parents as well affected by that. We fortunately have had most of these children be able to manage their symptoms at home with fever-reducing medications and then oral hydration, so making sure they're drinking well.